Hello, this is the partner assignment and surgical procedure overview on the word prostatectomy, and it's presented by me and my partner, Ida Asadi.
Hello, everyone. Let's dive into the term prostatectomy and the understanding of it. The term is a great example of a medical word built from Greek word parts. Let's break it down. Prostate O means prostate gland, and ectomy means surgical removal. So, a prostatectomy refers to the surgical removal of the prostate. The prostate is a small gland in men that plays a role in the reproductive system by producing seminal fluid. The word's root prostates actually comes from the Greek for one who stands before, which refers to the prostate's position in front of the bladder. This term is not an acronym or a modern term. It's formed from classic word parts used throughout medical terminology. And here we do have a visual graph that shows the bladder, the prostate, the urethra, and the surgical removal indicator or instrument. Prostatectomy is one of the most common surgical treatments for prostate cancer and benign prostatic hyperplasia, also called the BPH. It's especially common in men over the age of 50. And depending on the situation, the procedure may involve removing the entire prostate. This is called a radical prostatectomy, or just part of it in what's known as a simple prostatectomy. The procedure can be performed with traditional open surgery, laparoscopic tools, or robotic assistance. One important statistic is the 5-year survival rate for men with localized prostate cancer who undergo prostatectomy is over 99%, according to the American Cancer Society. However, like any surgery, there are risks. Erectile dysfunction and urinary incontinence are the most commonly discussed complications. The costs vary by region, but the procedure typically ranges from $10,000 to $35,000 in the United States. And a fun fact is that many prostatectomies today are performed using the Da Vinci robotic system, which allows for highly precise movements and often leads to faster recovery. The surgery usually takes place in a hospital's operating room, and it's done to treat localized prostate cancer, as I mentioned, or severe BPH when there's significant urinary blockage. After surgery, patients usually stay in the hospital for about 1 to 2 days. A urinary catheter is kept in for 1 to 2 weeks, and full recovery can take anywhere from 2 to 6 weeks. Recovery might also include pelvic floor exercises and PSA monitoring, especially if the surgery was for cancer. Now, who's involved in this procedure? The main surgeon is a urologist, but the team also includes the anesthesiologist, sorry, scrub tech, surgical nurses, and if cancer is present, an oncology team may also participate.
So the diagnostic tool they used in the PSA test, and usually it's before surgery, it's one of the most important diagnostic tools in the PSA test, which stands for prostate specific antigen. There's a simple blood test that looks for a protein made by the prostate. The PSA test is useful in 3 stages. In the pre-op, it helps detect the presence of prostate cancer. After surgery, it's used to monitor for any signs of cancer returning. And once the prostate is removed, PSA levels will drop to nearly zero, and that's how we know that the surgery was successful in removing cancerous tissue. This test plays a crucial role in guiding both the decision for surgery and the long-term monitoring afterwards. In common this procedure in more everyday language. When a doctor recommends a prostatectomy, it means they are suggesting surgery to remove all or part of the prostate gland, which is a small organ that helps make semen. The surgery is usually done for prostate cancer or because the prostate has become too enlarged, blocking urine flow. Before surgery, the patient will meet with the surgical team and the anesthesiologist to go over what to expect and how to prepare. During surgery, the patient will be under anesthesia, and usually general anesthesia. The surgeon may make an incision in the lower abdomen or use minimally invasive tools with a camera. Afterward, the patient will likely have a catheter for a week or two, and they'll need to avoid heavy lifting for a few weeks. Most people go home in 1 to 2 days and slowly return to normal activity within a month. It is common to have temporary issues with bladder control or sexual function, but those often improve as healing continues, and after surgery, PSA tests will be used to make sure that the cancer has not returned. In this section, we'll talk about prostatectomy, more about it, and why it might not or might be needed, particularly in the cases of prostate cancer. When surgery is required, one of the most advanced approaches is robotic-assisted surgery. This technique uses small incisions and robotic arms, which the surgeon controls while sitting at a console. A high-definition camera gives a magnified view, which helps the surgeon operate with extreme precision. Some key benefits of robotic surgery include less bleeding, a quicker recovery time, and a shorter hospital stay compared to open surgery. As for the surgical team, the urologist or surgeon operates the robot, while the anesthesiologist, nurses, and surgical assistants help manage the procedure and the patient's care. Finally, after surgery, patients can expect a short hospital stay, a period of catheter use, and a gradual recovery process over several weeks.
We have a case study, Mr. Robert Hill, about prostatectomy. Now let's look at a real life case study to help connect everything we've learned so far till here. This is Mr. Robert Hill, a 68-year-old male who came to the urology clinic with multiple urinary symptoms. He was experiencing painful urination, frequent nighttime urination, which we call nocturia, and a noticeably weak urinary stream. He also reported straining for 2 months just to pass urine and occasionally noticed blood in his urine, a condition known as hematuria. During his evaluation, the doctor performed a digital rectal exam and found his prostate to be enlarged and firm, a sign that something wasn't right. A blood test showed his PSA level was 12.6 nanograms per millimeter, which is significantly elevated. A biopsy later confirmed the presence of prostate cancer, especially adenocarcinoma. After discussing treatment options, Mr. Hill decided to undergo a robotic-assisted radical prostatectomy. His surgery was scheduled with a urologist trained in minimally invasive techniques. Before the procedure, he was thoroughly briefed on what to expect, including how to care for the catheter post-op and possible side effects such as temporary urinary incontinence and erectile dysfunctions. This case helps highlight the patient experience from diagnosis to treatment and also shows how robotic surgery is becoming a modern standard for prostate cancer care. The medical terms that we just used right now, let's now review some of the key medical terms mentioned in our presentation and break them down into parts. Dysuria, this means painful or difficult urination. It is built from word parts. Dys means bad, painful, or difficult. Urea means urine or urination. So together, dysuria literally means difficult urination. It's a common symptom seen in urinary tract infections, prostate problems, or bladder disorders. Number two is hematuria. This refers to the presence of blood in the urine, also built from word parts. Hemato means blood, and urea again means urine or urination. So, hematuria means a blood in the urine. It may indicate kidney stones, infection, trauma, or even malignancy. Number three is PSA, the prostate-specific antigen. This term is not built from typical medical word parts. It's an acronym. And PSA stands for prostate-specific antigen, a blood protein made by the prostates. High levels of PSA might indicate prostate cancer or other prostate-related issues. It's often used as a diagnostic and monitoring tool. And number four is adenocarcinoma. This is a type of cancer that begins in glandular tissue. It is built from word parts. Adeno O means gland, carcinoma means cancer, and oma means a tumor. Put together, it means a malignant tumor from glandular tissue, like what we see in prostate cancer. And number five is urinary incontinence. This term means the inability to control urination. It's not built from typical word parts, but its origin is Latin. In meaning not, and continentia means meaning holding back. So it means not holding back or losing control over urination. In the context of the prostatectomy, this is often a temporary side effect due to muscle weakness after surgery. These terms are essential to understand both the clinical language used in diagnosis and what patients may hear during their care.
Some critical thinking, or one critical thinking question we have is name the different surgical approaches used for this procedure and explain how each might affect the patient's recovery time and possible side effects. And we have the works cited page, and that's it. Thank you.
Thank you. Thank you for listening to us.